So here we are at the end of pandemic year 2. 2021 was another year we are tempted to wish away and forget. Yet it was another year of heroics at Duffy Health Center. It's important to reflect on what we learned and how we persevered. We accomplished so much in providing services to the community. We gained recognition from all sectors, and we are growing like a weed. Yes, almost uncontrollably like a weed. I'll talk more about that later. Ever the optimists and believers, we are looking forward to 2022. Duffy Health Center was incorporated on May 16, 1997, which means that we are celebrating our 25th anniversary throughout the coming year. To get the actual date, I looked up our incorporation papers and we'll get a kick out of this. All 4 officers, president, vice president, treasurer, and clerk, were our founder, Arthur Bickford. Not only that, he was listed as our only board member. I'm not sure that we could get away with that these days. This past year, we engaged in strategic planning led by a wonderful committee of board and staff headed by Jim Cullen, who is also with us virtually, our strategic planning committee chair. We identified over 25 strategic initiatives or projects that we could engage in over the next 3 years, which of course we had to prioritize. And so we grouped them into 5 strategic priorities. And I'd like to highlight just 2 of those for you now. The first strategic priority we are affectionately calling getting the Duffy House in order. We have a once-in-a-decade generation. Michael, I saw Michael coming in, Mike Curry, with the Mass Lead, who's been with the Health Center movement many years. I think probably the last time we saw this much movement in health centers was 10 years ago with ERA. 10 years prior to that, when the Bush administration came in and really made a push to expand the community health center program. And then 10 years prior to that, when Congress invented the federally qualified health center program. All of those were really milestones, but really, I think that what we're seeing right now is unprecedented, the level of support for health centers. So I'm going to call this a once in a lifetime opportunity to significantly shape the way we provide care by aligning our resources and implementing new tools to sustain our operations and engage with our patients. Space, technology, and staffing all will be impacted. Our management team, as I've said the best on Cape Cod, will use the resources provided by the American Rescue Plan Act, or ARPA, both directly from the federal government and through allocation of funds to the Commonwealth, to position ourselves for efficient, effective services designed to meet the challenges of what's called value-based payment, which is the new model that's going to be coming down from the Massachusetts Medicaid program. So first of all, space. Over the next 2 years, we will be expanding our footprint on the corner of Camp and Main in Hyannis by leasing additional space in the Urology Associates building. Technology. We'll be converting our electronic health record system to the EPIC system, which covers 80% of patients in the Commonwealth. If you are a Cape Cod healthcare patient, you know EPIC and you know MyChart. EPIC is the gold standard in EMRs, and Duffy will be a part of it too. Staff. We will be adding additional clinical and recovery support staff, IT staff, and another physician to our team. Our staff and clinical leadership will work to meet our patients' many needs and focus especially on the social determinants of health. Value-based payment for effective and efficient care coming from our value-based philosophy of care, which is creating trusting relationships with the most marginal in our community, creating trusting relationships with the most marginalized in our community. That's our wheelhouse. Another strategic priority I'd like to highlight is responding to community gaps in services. Now, if I were you, I'd be saying, well, isn't that what you're supposed to be doing as a not-for-profit and Duffy Health Center? Isn't that what all not-for-profits are supposed to be doing, meeting community needs? But where we find ourselves these days is that government, foundations, community partners are all asking Duffy Health Center to do more. I call this our success begets success priority. I started adding it up in my head the other day, Jeff Dykins, and in just the past 2 months, I have signed contracts for $2.5 million for new programs and projects. $2.5 million is 25% of our budget for FY22. These awards include $400,000 from the Massachusetts Department of Housing and Community Development and the town of Barnstable to support our In From the Streets winter weather response program. $500,000 from federal COVID relief funds to renovate our waiting rooms based on COVID response needs for social distancing and to replace our computer equipment. $500,000 from the Federal Substance Abuse and Mental Health Services Administration in this year and in each of the 5 next coming years to expand and improve retention in our medication-assisted treatment program, our Suboxone program. $600,000 from the State Bureau of Substance Addiction Services to expand our Moms Do Care program for pregnant and parenting women with opiate use and other substance use disorders. $300,000 also from BSAS to expand the alternative peer group program, where Duffy is the clinical partner with behavioral health innovators, and I know founder Stephanie Bridey is also watching us virtually, to offer safe and healthy alternatives for teens with problematic alcohol and drug use behavior. And just last week, we learned that we are receiving $140,000 per year for the next 2 years to expand our community health worker program to support our patients in managing their chronic illnesses through the Mass League of Community Health Centers and my friend Michael Curry, who will be coming up here soon. This just doesn't just happen. It takes years of cultivating relationships with funders, with our elected officials and community partners, developing evidence-based programs that deliver results, and a passionate, dedicated group of professionals that will never, ever give up on the people that we serve. That's our future. That's our past. That's where we're headed. Restoring health, rebuilding lives. That's our tagline. It's what we've done for 25 years, and we promise to continue. Thank you. Okay, now comes the fun part. It's now time to present this year's annual meeting awards. I'd like to ask Mike Curry to come up to the front, please. I'm so pleased to present this year's Advocacy Award to the Massachusetts League of Community Health Centers. You can hold on. Oh. You don't know what to do these days. I'm a big hugger, but anyway. We have Mike Curry, and is Karen here with you?
Karen's not here, she had emerged.
Okay, okay. Well, I think there's a few online there too. The Mass League is what is known as a primary care association, meaning that they represent the community health centers statewide. But the league is so much more. They're actually the granddaddy of primary care associations and admired across the country. Our beloved Jim Hunt, Mass League CEO for 43 years, retired last year, paving the way for Michael Curry, formerly General Counsel and Deputy CEO, to ascend to CEO. Michael also serves as a board member on the National NAACP and is a frequent speaker on the topic of structural racism and its impact on health. I heard Michael speak a couple weeks ago straight for 2 hours, and I think you probably do that 2 or 3 times a week. I was like blown away. Michael co-chaired a State House Health Equity Task Force in the wake of last year's racial justice movement. The task force created a blueprint for Massachusetts' use of COVID response funds as a catalyst for addressing health disparities. The League carries forward the National Health Center agenda locally, organizing our health centers to advocate with our federal officials for health center funding and policies. And you all know how effective that has been recently for Duffy Health Center with all the funding I just listed. However, this year, the League provided exceptional leadership through planning, analytics, and the brute force of argument, representing health centers in negotiations with MassHealth, our state Medicaid program, to bring health center reimbursement in Massachusetts in line with federal regulations. And we're not doing that before. We're getting ready to sue them, but they negotiated instead. Our Mass League team, headed by Michael and including Caitlin McColgan, Catherine Cohen, gotta give it out to the girls.
Yes.
Morgan, Morgan McAllister, Liz Sanchez, and Maya Sanders hit the ball out of the park on behalf of health centers. This effort will yield parity for behavioral health services with medical services. So behavioral health visits will be paid at the same rate as medical visits. And net Duffy Health Center upwards of $1 million per year in additional patient service revenue. In recognition of your outstanding leadership, we present the Duffy Health Center Advocacy Award for 2021.
It is an honor and a privilege to be here representing the Massachusetts League of Community Health Centers. One, recognizing my predecessor, Jim Hunt. 43 years of building this movement we now know as the Community Health Center movement in Massachusetts. We are proud of that history. The first health center in the country in Dorchester, second in Mount Bayou, Mississippi. And that work continues now in many health centers across the country. I was thinking about Heidi's remarks and what I wanted to acknowledge when I came tonight. And I was reminded in a radio interview recently, I was traveling last year during COVID, and I was sitting in the airport and a group of providers walked through. And they must have been on loan to another city, another hospital. And they walked through and they had their medical garb on, and people started applauding them like they would do the military. And I think any of us in the airport that day got emotional because we knew at that point, people didn't know how contagious this was, and whether you were risking your life going to Brooklyn or coming to Massachusetts, wherever you were headed to do that work. And it reminded us at the Mass League why we do what we do, because we're not frontline providers. We're not in the trenches like you are. But our job is to provide you with the resources, the advocacy, the TA, the support that you need so that you can meet the needs of the patients you serve. As a speaker of a house told me one day, he said, that's God's work. What you do is God's work, and we feel like we're supporting you in doing God's work at the health centers. That being said, as Heidi said, credit to our government affairs and public policy team, as well as all the folks at the Mass League who really fought hard, and it was not easy to convince the state that they need to invest more in community health centers. There's so many competing challenges. I don't think that it's not that they're not good people. It's just that when you have a long line of providers, all of them underpaid, all of them needing more resources, and then you're the health centers in line, that takes a big voice. That takes data. That takes great advocates who, when you ask, like Heidi and the staff here at Duffy, that says, hey, we need you to call your legislators, local, we need you to call your federal legislators. You're always willing, ready, and able to do that. So on behalf of the Mass League, we are honored and humbled to receive this recognition, and we'll keep doing what we do on behalf of you, your patients, and your community. Thank you.
And now I'd like to ask Kristen O'Malley to come up. Please come forward. It warms my heart to present the Duffy Health Center Community Partner Award to the Cape Cod Foundation. This evening, we have CEO Kristen O'Malley here to accept the award. I think everyone knows the Cape Cod Foundation. It's a community foundation that provides a place for persons with means to create charitable funds that are pooled and invested wisely, creating a funding stream locally for scholarships and grants to not-for-profit organizations. Since 1989, the foundation has funneled $80 million back into our community. Last year, we recognized the foundation and others for their outsized contributions to fighting COVID on Cape Cod. This year, weary as we are, the battle is not over. And the foundation has been with us every step of the way. When our In From the Streets motel stay program ran dry of resources in June, all I had to do was pick up the phone, and the foundation, as well as the United Way, immediately sent checks to replenish the fund. Then, this year, something else astonishing happened. I asked Kristen if the foundation could help us with funding our business planning effort to create a medical respite program on Cape Cod. Medical respite is a national model to provide a safe place for people who are homeless to recuperate after hospitalization or other illness. Kristen has been an active and enthusiastic supporter of the development of the program. When we ran short of the funds needed for our contract, Kristen organized a group of funders, including the Cooperative Bank of Cape Cod Foundation, to hear our story, and miraculously, $12,000 additional was secured, in addition to funding that we received from our friends at the Cape Cod Commission with all of our inside pals at the commission also brought resources to that medical respite project. Kristen, we are so grateful for your support of Duffy Health Center and dozens of other not-for-profits on the Cape. We present you with the Duffy Health Center Community Partner Award.
Would have fixed my lipstick if I thank you so much for this special award. We're really proud that over our 32 years, we've built some amazing partnerships like the one that we share with Duffy. The work of Heidi and her team to serve the most vulnerable residents of our community is really invaluable. The agility and the creativity that they've demonstrated during the pandemic is unparalleled. So while we're honored to be recognized tonight, on behalf of all of us at the Cape Cod Foundation, I want to say thank you to Duffy for the essential role that you play. When we have strong, impactful organizations like Duffy working in our community, it really makes our job easy. So thank you again.
And now I'd like to ask Melissa Payne and Cindy Glista to please come forward and join me. Cindy, did I surprise you? I made you come. We do this every year. Every year. Okay. Melissa, why don't you stand next to me? Cindy, we'll do a Melissa sandwich.
Okay, sounds great.
All right. We christened our Employee of the Year award the Cindy Glista Award in 2017, the year of Cindy, this one, Cindy's 20th anniversary at Duffy. You see, Cindy Glista is employee number 1. She was our very first employee, and she still works today. We asked our employees to nominate a colleague for the Cindy Glista Award, which is basically our Employee of the Year award. And this year's recipient is Melissa Payne. the 5 nominations that were submitted on Melissa's behalf, the consistent theme is that she embodies the Duffy Health Center values. She meets patients where they're at. She's non-judgmental, compassionate, kind, and passionate about public health and harm reduction. Her peers see her as a team leader and have assessed her as possibly the funniest person on staff. One colleague shared that she began working at Duffy during the COVID shutdown when our outdoor shower program was in full swing. She shared, community members would make this program a part of their day. Sometimes it was for use of the shower, but I noticed that a lot of folks came just to see Melissa. She has a way of making everyone around her feel comfortable to be themselves and comfortable to ask for any of their needs to be met. Not only was she able to create a platform where folks could ask for help, but she assured them that she would help meet their needs or use her resources to assist them. It was powerful. Colleagues feel confident in referring patients to Melissa for recovery support services. They know she builds trust and rapport with every patient, advocates for patients whose challenging behaviors have limited the support available to them. She goes above and beyond her job description to meet the complex needs of folks in the community, whether they are a Duffy patient, a referral from a community partner, or someone just showing up at the door, or someone that Melissa met on outreach. The support our patients need in relation to substance use is often complex and difficult to attain. Melissa consistently assesses these needs and works with patients to find options and solutions when it seems there are none. Melissa is a shining light at Duffy, who brightens everyone's day with her positive energy. Congratulations. Congratulations. And now I'll call up Sarah Graham back for our final 2. Did you want to say something?
Oh, no, I'm fine.
sorry.
I didn't have to say.
I'll just say thank you so much. And I'm incredibly honored. Thank you, Heidi, and to all my colleagues. So thank you.
To present Sarah Graham back, who is our Director of Development and Community Relations.
I think we may have, did we lose the audio? I don't need that. So, but I just, I think we lost it. So it's totally fine. Anyway, I'm loud. Thank you all for being here tonight. For those of y'all I haven't met, my name is Sarah Graham. I'm the Director of Development and Community Relations. I have the privilege of connecting with people in our community, supporters, donors, community organizations, and agencies in support of our work and the patients and clients that we serve across Barnstable County. And I'm blessed to have been with the agency for almost 3 years now. And so thank you all for being here tonight. And virtually, I'm going to recognize for the last 2 awards. First, I'd like to invite Jamie Pina and Karen Herron up. So Jamie and Karen started a little motorcycle ride in 2018. Their families, their lives have been touched by substance use. They have family friends who have lost their lives to addiction in our community, and they were motivated to make change and make an impact and raise a little bit of money along the way. Their first ride was in 2018. You may have heard them roaring through your community on September 12th of this year, where the ride has grown from just in Barnstable to Falmouth to Barnstable, with hopes of growing the ride even further down the Cape to make an impact even further. How many bikes did y'all have the first year?
100,
100. And how many did you have this year?
400.
400 bikes this year.
I'm sorry.
375. Okay, no round that, Karen. 400 is good. That's okay. So Jamie and Karen, from their hearts, started this motorcycle ride, and with a dedicated team of volunteers that have grown over the years, fundraising. I said to Christina after we saw Jamie a few weeks ago that I'd like to hire him to do our sponsorship and fundraising, because they're not a duo. They have volunteers supporting them, but they are already working on their next ride and are committed to raising funds in support of transitional housing and sober housing for people in our community. Their gift we are one of a couple of beneficiaries of the Roar Ride. And in 2018, we received a very generous gift of $5,000. This past year, just a couple of weeks ago, I should say this past year, COVID, just a couple of weeks ago, they met with our recovery support navigators and our SUT team in our lobby to present us with a $20,000 check. You all got the honor of meeting Melissa Payne, and Melissa was one of the staff members in the lobby. And she looked over to Karen and Jamie with tears in her eyes and said, "This is changing lives. The money that you are raising is changing lives for our patients who need to move into safe, sober, and transitional housing as they are getting their lives back together and moving on in their recovery journey. It is absolutely changing lives, and we are so very grateful for your ongoing yeoman's work of fundraising and organizing, and we're tremendously grateful to you and to your teams and all that you're doing for our patients and our clients. So.
Thank you. Karen's the brains of the operation. I'm the mouth. So I'll say a couple of things. You know, we started this out because we both have sons who are addicts. Mine actually got some help into sober living. So when we saw what happened with them getting the help into sober living, the way this outfit that helped them did it, we said we could do that. We ride so many times. You know, when you see any given Sunday, 100 motorcycles riding down the road, those motorcycle riders probably paid $20 to ride that ride. Then they probably, when they get to the destination, bought a shirt for $20, bought some raffle tickets, and they're very generous. So we thought, wow, the motorcycle community is very generous. We've seen enough of it. We've been riding for several years. So we decided to do this. Why can't we were literally on the bikes, and Karen says, why can't we do a ride for opioid addiction and recovery or something? That's where ROAR came from. That was the acronym right there. So it just, we said, let's do it. We did it. We have, I gotta say that we can't do this alone. We have about 10 people that are committee members that we meet with monthly to do this. And we also have probably 40 people that show up on the day of the ride to help sell shirts, stage motorcycles, put signs in the ground, do whatever we need to do. And without them, we couldn't do what we do to raise money. I beat a lot of doors down during the year just to get money, and I've been pretty lucky with it, and I've got a pretty good group of people that I can depend on. We also are a donor advised fund of the Cape Cod Foundation, and we appreciate your work with us, Kristen. Thank you very much. And that's all. Thank you for recognizing us. We appreciate it.
I just want to say, I think it's a community effort, and I think what Duffy does with the funds that we give them is tremendous. So everybody has to work together. We all do something.
Next, I'd like to invite Lisa Oliver from the Cooperative Bank of Cape Cod to come up, please. You can tell my remarks are a little less formal than Heidi's, so I hope that's okay. A little ad-libby. As you've heard through Heidi's remarks that, the past year, the growth, the challenges, the support that we've gotten from financially and otherwise through Mass League, through the state, through the federal government, through our local partners like the Cape Cod Foundation, the Cooperative Bank of Cape Cod. That's because of the last 25 years of leadership and stewardship and growth and commitment, and Cindy Glistas, who are here tonight, still with the agency. And we're so very grateful for that. And that long-term support, one of our partners is the Cooperative Bank of Cape Cod. And when we shut our doors on March 16th, 2020, one of the first phone calls we got was from the Cooperative Bank. How can we help? The relationship had already been established. Lisa had been through, did a tour with Heidi. She saw how the sausage is made, which is the most important thing about learning what we do, is really being in it and seeing it happen. It looks a little different now during COVID, but it really changes the game in people's understanding and how our providers and our staff are supporting our patients and clients. But one of the first phone calls was, how can we help? How can we support you? And it wasn't just, how can we support you financially? It's, what do you need? What are you doing? How can we be creative? How can we support the agile programs that we were talking about? Kristen referenced that shower program, for example. The COOP gave us money to stand up a cover for our shower program when we resurrect that in the spring in our parking lot. Just the outstanding generosity that's not just, we want to financially support, but we want to know what you're doing. We want to help you grow. Let's have conversations about what that looks like. It's really a commitment beyond just a check. And we're incredibly grateful to the COOP for the ongoing support, from general operating donations to sponsorships to COVID-19 funding. It's really been incredible, certainly over the last year. And we're just really pleased and proud to have you all as a committed partner for our work. And we're very, very grateful for it. Thank you very much, Lisa.
Glasses on, taking a mask off, grabbing paper, there's usually a flying earring involved. So I made it through that relatively easy. It is wonderful to be here with all of you tonight in celebration. That would be my first comment. Celebration of what community can do during tough times. We know we're excellent in good times, but it's really been apparent over the last couple of years, the importance of creativity, of everyone coming together and say, I don't have a playbook for this. How do we make this work? And then the partnerships, which have been mentioned all night long, that come together to bring visions to reality and take that creative need to figure out, how do we do it now? I can't do this. What else can we do? And by the way, here's a brand new set of needs that we never imagined having to tackle. So the past couple of years through that challenge, we, and I'm very proud of the team, a number of whom are here tonight, have taken on and dug deep. And our 3-year-old foundation, we pushed it and we said, this is one of those extraordinary circumstances where we need to give more than our foundational give would dictate. And we reached deep and we made phone calls, and we did. We had heard about the shower program at Duffy, and we said, we want to help with that. But by the way, what do these people wash with when they take a shower, and how do they brush their teeth? And so we helped to support the COOP kits, which were essential hygiene kits for the people using the showers. So they actually came in and had their own set of utensils for hygiene to be able to use, which, as we heard from the team, was really life affirming for so many who felt so disenfranchised during the last couple of years. And then this year, which was our 100th year, still is, actually, it's still 2021. Needs to go on. We had an event, well, we had a number of events, but one of the things we did was pull together and gave 100,000 in 100 days to represent our 100 years in business. And that the employees voted one of 10 organizations to receive a grant from that offering, and it went to Duffy, also because of the good work, and that was an employee choice. So as a bank, our foundation, previous to having the foundation and the number of years that we've supported Duffy individually, the time, talent, and treasure of our employees is invaluable to how we approach organizations within the community. I'm so proud of all of them. And one final note, a special shout out to our branch manager in East Harwich, Carol Bradley. For those in the know, and this is a fun story, she has a talent that none of us can compare to, but she is I think there's a specific word for it, but she is a master couponer. And I will tell you what, I think she pretty much doesn't pay for the things she purchases, and she can purchase so much free of charge, and she donates it all to Duffy.
That's why I'm so excited.
And you know, she's one of those people in the background, and goodness knows there are so many who do devote their time, talent, and treasure to helping others, and she is one of those wonderful people in our organization. So thanks to my team here, with a special shout out to Leanne Hess, who's the head of she's our chief engagement officer, and among other things is the head of the foundation for the bank, and Jess. We had about 18 Jesses that came in. That's really bad. I'm like, what's doing it? It's terrible. Anyway, Jess was our employee representative to the foundation when we established it. We felt it very important to have a local representative within that group. So Jess, thank you for your time and for your advice and your guidance in that space too. So thank you all. Continued best wishes, and we'll be there to support you. So now I would like to welcome back Kathleen Brissett.
Thanks, Sarah. Thank you. Before we close out the program, I have a few things to do, and I'm going to throw a little audible in here, as I usually do. So we thanked a lot of people this evening. You know, we gave awards. Thank you to all the awardees. I mean, we really couldn't do, or the center couldn't do, we don't really do much as a board, but the center couldn't do what they needed to do without you all. But at the end of the day, it doesn't work without a leader. So I did want to take 2 seconds to just recognize Heidi as our fearless CEO. So if you can stand up for us. I've been on the board for a long time, and every year she gets better and stronger and more dedicated to the mission. And the last 2 years have just been extraordinary. So thank you. All right, so let's do some more thank yous. Thank you to the Cultural Center of Cape Cod for hosting us, Peterson's Market for the delicious food, Chatham Light Liquors, and Mainsail Events, Jen and team, for their support this evening. We're grateful for everyone's support. We can't pull off events like this. We don't just have a checkbook. We don't go to Jeff and say, we want to do a dinner. Let's, give us a check. It's interesting. I was actually sitting there thinking when Heidi was talking about all the ways that we received money this year and last year, I'm like, wait a minute, I got to ask people to give more. That's not very fun when we've had such stellar years, but we need to do more, right? As a community, as people, think about how you can help Duffy in any little way. We have lots of willing people to talk to you about how you can help and how you can give. There's a couple of exciting things coming up I just wanted to bring attention to. One is Wellness on the Water. This is on your table. This is a yoga event that we've organized. It's at the Witchmere Beach Club. There's 60 people that will be live, but I think it's also going to be streaming. And that's a good way to give. And if you can't participate, give, right? Are we doing shirts? Cool shirts? Yeah, there's cool shirts that you can buy, and we'll get some information back out to you as well, correct? So that's one way to give. Also, just wanted to let you know on your table, hot off the presses, is the strategic plan that we just put together. I actually think it was just printed today. That's correct. So I haven't even looked at it, but there it is. And then this is always amazing. So just please take a look and take with you Duffy's doings. I think it's a really good way to stay kind of in touch with what we do and what we do in the community, which I think is, as everybody has said tonight, it's been pretty extraordinary. I mean, it's just an extraordinary honor to serve on this board. I think the board members share in that feeling. Thank you everybody online. I know it's not very fun sometimes to stare at us, but we'll wave and there's people waving back, so that's great. And I think unless Sarah or Christina are gonna tell me I missed something, I think we are adjourned. And thank you very much for all your hard work and commitment to Duffy Health Center.